we are here today to launch a publication that it's looking at the gender-based violence against women and people of diverse gender identity and expression who use drugs. We worked together with our colleagues from WHO and other UN organizations, and also from the community with the network of people who use drugs and the network of women who use drugs, to put this publication together in order to support the member states to reach one of these 10 targets that we all know very well. The fact that we hope by 2025, less than 10% of women and girls will experience gender-based violence. Ideally, it will be 0. So I think there is a presentation.
Just see what happens if you go forward. Yeah.
Okay. So I'm going to take you through the publication, and I'm going to be honest from the beginning. I don't have yet the link because the paper, it's still in the design, with the design team. But the link will be available soon on UNODC website, and I promise that I will share the link with everyone as much as I can. But you have the cover, so you will recognize the publication, and I'm proud that we have this cover because this is the work of an artist that belongs to the network of women who use drugs. So I'll skip this slide because this is about UNODC and how we are working to support member states. I was mentioning the 10-10-10 targets, so here they are. And with this publication, we are, as I said, supporting member states to meet the second of the 10 targets, meaning women and girls and from the key population experience, won't experience gender-based violence, if we are focusing our efforts to achieve this. UNODC has actually an initiative on addressing the needs of women who inject drugs. This initiative was generated in our civil society group on drug use and HIV. It was the request that we received from the community to focus on this topic, and we are doing this for a couple of years now. We have a technical tool, we have a policy brief, and we have also together with our colleagues from WHO, a publication on prevention of mother-to-child transmission. And while I'm in the presentation, I realized that I forgot to introduce myself, and I forgot to introduce Annette. So I'm Monica Ciupagia. I am the thematic focal point for drug use and HIV, and today with me I have Annette. Will you introduce yourself, please?
Thank you, Monica. I'm Annette Verster, and I work at the Department of HIV, Viral Hepatitis and STIs in WHO here in Geneva, and I'm responsible for all key populations, including people who use drugs.
Thank you. And later you will see on the screen Ruth Birgin, who is actually the consultant who prepared this presentation, and she's from the network of women in harm reduction programs. So why we started this initiative? Well, you know, at least 155 countries in the world have passed laws that are supposed to end the violence against women. And yet these laws are many times not implemented when it comes to women and gender diverse people who are using drugs. They are subject to intimate partner violence. They are at more risk of acquiring HIV due to this violence. And also they are not victim of the violence when it comes to their personal circle, but they are also victim of violence when they are interacting with the official structures, with law enforcement, or when they are going to, in some cases, to ask for medical support and so on. And for this, they lost the trust in these services and are avoiding the services because of the violence, because of the stigma, discrimination, because of fear that trying to report what's happening to them in these situations will get the things even worse, and they may be in the risk of losing their children, as they will be perceived as offenders. So the publication, it's actually listing a number of international policy frameworks that exist for many years that help us to guide the prevention and response to violence, including gender-based violence, and to mitigate stigma and discrimination, and to ensure the rights of all women, including women who use drugs in all their diversity. There is a list here of these international commitments. There are more in the book. So, while these international commitments exist, more needs to be done for them to be implemented. So the paper is giving some recommendations on what are the good practice elements on gender-based violence-related services for women who use drugs in all their diversity. So we are listing them under useful approaches. And the first one that you will see here will be the meaningful community involvement. And also the service integration, the capacity strengthening, the data collection and research, women-only safe spaces, and also gender-based violence raising and safety planning. Many more in the publication. And also services that can be put in place to support women who are victims of gender-based violence, and also to services that can prevent the exposure to situations that may lead to gender-based violence. So documenting gender-based violence, comprehensive sexual and reproductive rights, health services, clinical services that respond to sexual violence, shelters, and this is an important issue that came during the COVID, that the shelters that are accessed by women are not always open to women who use drugs. And during the COVID, actually, there was a big problem because there was locked in their houses when they were victim of violence. They had no other place to go to protect themselves. Legal aid, gender-specific peer outreach, take away OAT so the women will not go every day to the OAT clinic and sometimes be exposed to violence, parenting support, sex workers focused and led responses, income generation to get financial independence, drug checking, and assisted referrals. Of course, there are also additional recommended responses for member states to follow the international commitments for a specific situation, like responding to humanitarian crisis, policy and government responses, and uphold commitments to international human rights frameworks and mechanisms. I will skip this, but this is a case study that it's in our publication. It's the project Medineres, who actually is an amazing example of harm reduction project that is also looking into the prevention of gender-based violence and providing their women clients support. And I will end by thanking everybody who was involved in the preparation of this publication, from the colleagues from the UN agencies and from the civil society and the community of people who use drugs. Thank you.
Good afternoon again. I just wanted to add a little bit of information around what WHO is doing with regard to this topic. I think Monica has given an extensive summary of the actual policy brief, so there's no need for me to add to that. Just to say that in 2022, last year, we published consolidated guidelines on HIV, viral hepatitis and STI prevention, diagnosis, treatment and care for key populations. And just wanted to give you some details of where we address the topic of people use drugs, trans and gender diverse populations and violence. So just to say that I think it's been summarized and we all know, but that stigma and criminalization or punitive or harsh laws and policies fuel actually violence of people of these key populations, in particular the populations I just mentioned. Of course, there are other reasons that other things that will impact on all this, such as general poverty and gender, race, disability and education. But just to say that all these issues impact directly on accessing health services, life-saving health services for these three diseases that we looked at. And this is, for example, access to condoms or access to needles and syringes, access to PrEP or OAT, opioid agonist maintenance therapy. They're all impacted by these structural issues and related to criminalization and stigma. So that's why we have come up with a package of interventions that actually prioritizes enabling interventions as a first area to address in order to access health interventions. So here you see the 4 types of interventions that we try to prioritize. So essential for impact, direct impact on HIV, hepatitis and STIs are interventions to address structural barriers to accessing the health interventions. And then the health interventions are split in 3 types of interventions. The ones that have a direct impact, again, on the 3 disease areas, and then some broader ones and supportive ones. And I will show you the overall package for people who use drugs. But just to say that the first 3 areas are actually essential in all settings. So this also goes for the enabling interventions. So here you see the overall package, and in green on the top you see the enabling interventions, and you can see that the 4th is addressing violence. After reviewing laws and that criminalize people, and stigma and discrimination and empowerment. And then you get the health intervention. So this is what the package looks like. So when you then go to the enabling interventions, you see the violence here. This is the actual recommendation that is phrased as a good practice statement because of the type of evidence that was feeding into this recommendation. So basically, violence against people from key populations should be prevented and addressed in partnership with key population-led organizations. And all violence including gender-based violence, should be monitored and reported, and redress mechanisms should be established to provide justice. So this is the official WHO recommendation on violence. So I think I've tried with the first figure to show how criminalization and laws and policies and also policing practices and cultural and social norms can legitimize stigma and discrimination that then feed into violence and to people with conventional gender and sexuality norms and identities, as well as behaviors such as injecting or using drugs. So the experience of violence has shown that they negatively impact on people's health and that they increase drug-related harms, reduced uptake of health services, inconsistent condom use, depression and other mental health issues, and increased HIV infection, as well as a direct impact on HIV and STI acquisition. So although, of course, there are a lot of issues around reporting, as Monica also outlined, it is often a first step in creating awareness to make sure that violence events are documented. So just to say that other colleagues in other departments, not just working on HIV, viral hepatitis and STIs, but on women's health, also are doing a lot of work on violence against women predominantly. And I just wanted to say that, for example, the Sustainable Development Goals, they also have a specific goal for reducing all forms of violence against women and girls in the public and private spheres, including trafficking and sexual and other type of exploitation. And finally, I think it is important also to stress the role of the health sector. That, of course, is most relevant to us as a health agency. That the health sector has an important role to play in addressing violence, both in taking care of women post-violence, whether it is physical, psychological, or otherwise, and to provide services, evidence-based services, and referral also to social and legal services. I think that's it. Thank you.
Thank you very much. And now we have a video recorded by Ruth, and she will talk a little bit about the development, and then there is another video in her video about raising awareness about gender-based violence. Can we see the video?
Hello everyone, and thank you for attending this session launching a critical new brief which we hope and trust will be widely heeded. To introduce myself, my name is Ruth Bergen, pronouns she and her, and I am an unapologetic drug user with heroin and cannabis my drugs of choice. This presentation gives you a little background on the development of the briefing paper and highlights some of the content areas with some emphasis on the centrality of meaningful community involvement. A few words about RIN, the Women and Harm Reduction International Network. It's an organization working to highlight the gendered impacts of drug prohibition and the need for gender-responsive harm reduction services globally. The network is led by women and gender-diverse people who use drugs, and its structure actualizes the principles of pragmatism that propel harm reduction by including all those who support RIN objectives, amounting now to almost 400 allies across all regions of the world. We note the diversity of lived experience, while also spotlighting, with an intersectional lens, the ways in which patriarchy and prohibition have combined to disadvantage women and gender-diverse people, showing how poverty, ethnicity, age, and socio-economic status and other factors combine with gender and drug use to bring specific oppressions, risks, and needs. Special congratulations are due to UNODC for collaborating with RIN and other community stakeholders, along with UN partners and relevant NGOs, in the development of this paper, reflecting commitment to the principles of meaningful community involvement as well as wider stakeholder engagement. This paper was developed through literature review and several rounds of expert feedback, which ensured scrutiny and inputs from women who use drugs, from RIN and other networks of people who use drugs, along with alignment with international best practice and guidance on gender-sensitive policy and practice. The list of reviewer organisations is presented in alphabetical order in the paper, but here is ordered to highlight the extent of community voice. The paper is designed for practical application to assist harm reduction services to incorporate a gender lens and integrate gender-based violence prevention and response elements. The briefing paper summarises key data, context and challenge areas, relevant international standards and guidelines, recommendations for service providers, government and the UN family, along with practical guidance with case examples. This slide shows the paper's table of contents. We will glimpse the subtopics setting context for the paper and then explore some of the good practice content. Evidence indicates that women who use drugs experience rates of violence up to 24 times higher than women in the general population. Yet data from many countries remains scarce, particularly for gender diverse people who use drugs. The voice, health needs and human rights of women and gender diverse people who use drugs are too often neglected. Drug laws combined with patriarchal norms, intersecting and compounding stigma, restricted access to health, criminalisation and disproportionate incarceration make women and gender diverse people who use drugs among the most disadvantaged groups in the world. With incarceration of women jumping by 59% over the last 20 years, women who use drugs receive punishment even if they're seeking support. I only mention women specifically here because there is simply no data available outside the gender binary. In most jurisdictions, access to gender-based violence services is contingent upon abstinence, which in practice forces women and gender diverse people who use drugs to continue to be exposed to violence. Human rights crises have also been shown to elevate the already disproportionate incidence of violence against women who use drugs. Without time to expand on each of these, please review these subtopics on approaches that should be considered in implementing gender-based violence prevention and response services. We will then watch a short video on the Eva Wood campaign, the Elimination of Violence Against Women Who Use Drugs campaign, which is used as an example of community engagement in response to violence against women and gender diverse people who use drugs. Picking up on a number of these approach elements, including meaningful involvement, challenging gender stereotypes, demanding accountability, stigma and discrimination, and advocacy. Stigma, gender inequality, and criminalisation have combined to create conditions where violence is not only common, but also, in practical terms, effectively sanctioned and endorsed. RIN advocacy works to bring these conditions into sharp relief and to promote immediate and longer-term normative guidance to respond to and ultimately end such human rights violations against women who use drugs. For example, with the support of the Robert Carr Fund, RIN has been able to coordinate a small grants program to enable campaigns led by women who use drugs to call attention to systemic violence against our community in respective local or national contexts. The Eva Wood campaign is growing each year and already has been enhanced by partnership engagement from networks such as Euro and Wood and Youth Rise. Flashing through this presentation are images and participant quotes from the 2019 and 2020 campaigns, which were run across more than 20 countries. They give you a glimpse of the energy, bravery, creativity and determination of the activists involved. The Evawood campaign activities have included awareness raising, correcting of negative perceptions and the presentation of requests and demands for rectification in the form of social media blitzes, the launch of lived experience books, videos and webinars, art and sport activities, press releases, public marches, demonstrations and rallies, podcasts, storytelling, formal meetings with parliamentarians, police, community lawyers, health officials and women's ministries, national symposiums, music concerts with bespoke rap performances, letter writing to women who use drugs in prison, art therapy, empowerment and self-defense classes and more. In this slide, you see services that are needed to complement the comprehensive harm reduction package, which should always be applied with gender-responsive approaches, including those listed in the last slide. Those approaches must also be applied in integrating sexual and reproductive health services, including these gender-based violence-related services. Many of these services are described further through living programmatic examples among the annexed case studies towards the end of the briefing. I hope this presentation has helped to pique your interest in reading, using and sharing the briefing paper. Thank you.
So, thank you very much for joining us. The next steps in this initiative will be to have the publication available online in a couple of days. And then following that, we will develop a capacity building program, also with the support of Ruth and other colleagues from the community. And we'll prepare, we'll roll out a training program on, how to implement the services, how to implement the recommendations in this paper in order to ensure that less and less women who use drugs are victims of gender-based violence. Thank you very much, Annette, for supporting us through the process and for supporting us today to launch it. And we're looking forward to see you in the next events where we are going to talk about this paper and the capacity building program. Thank you.